Well, good afternoon, everyone. My name is Sean Egan. I'm the Director of COVID Workplace Safety, and I appreciate you joining us for another one of our live Q&A sessions. Today, we're going to focus in and talk about an issue that's become more prevalent over the last couple of weeks, and that's potential phased-in return to in-person office work over time. We're going to talk about a few of the things that we're considering and things moving forward. We'll take a look at the MIOSHA emergency rule that's been discussed greatly over the past few weeks and what that actually means, and some of the considerations that we'll have to take under advisement while we're working through this work group as we discuss what a phased-in return to in-person work can look like. As you know, in Michigan, we have been working hard to contain COVID. All of you, all of us, all of Michiganders have been really working to make sure that we can contain this virus, and it sure has been a tough year. As you can see here, that we've had over 610,000 confirmed cases in COVID. We're closing in on 16,000 fatalities. Hopefully we don't hit that number, but that there have been a lot. As of today, we are at about 5.3% positivity rate and 158.1 cases per million. So we're continuing to see COVID kind of go up and down. In fact, over the last couple of weeks, we moved from a low of around 3% positivity back up into this 5.3% positivity range, which means it's just that much more work that we all need to do to remain diligent to implement the safety protocols and mitigation strategies in our lives and in our workplaces to ensure that we can continue to contain COVID, especially as we're all hearing about variants and other things that are taking place. We also want to highlight that as we consider what the next steps of COVID look like in Michigan, one of the most critical pieces is going to be the vaccination. The state and local public health departments, local hospitals have been doing a great job getting vaccinations into arms. Very happy to report on 3/14 that we're at about 24.4% of Michiganders that have had at least the first dose of the vaccine. We're at about 13.7% that have received both doses of vaccine. And when we talk about workplaces, one of the things we always bring up and talk about are that this is a place of congregation. Some workers have to be at work. That's their physical location. That's where the work is. Some workers have continued to remain remote. Avoiding that congregation really helps us, and driving up vaccination rates is going to help us move back to a more normal life that we all want to get back to. So as I've said before, we certainly have a big light at the end of the tunnel, but we're still in the tunnel and we have work to do. So I'd encourage every Michigander now to sign up as soon as they can for their vaccination. As we saw just last week, opening up signups in April is going to happen for anybody 16 or older. So make sure you take advantage, get signed up, get ready, and have a plan for your vaccination. And employers, really focus in on finding ways to encourage or engage your employees in getting these vaccinations to ensure that we can get back to work safely, including some of those mitigation strategies. And we'll have some time to go here that we'll have to work through that as vaccination continues to increase. When we talk about workplaces, we have outbreak data that's been reported to DHHS from local public health departments over this entire crisis. It's taken on a couple of different formats, but this is all available to you at michigan.gov coronavirus. They have all of the weekly reports that have been posted over the last year, and you can certainly take a look at this data and see what's happening. When we look at outbreaks reported by setting, we can see that workplaces account for a significant percentage of those total outbreaks reported. There are some reasons for that. Workplaces are obligated to report outbreaks in their settings, so that helps make sure that we identify those quickly and help employers take the steps necessary to protect employees by isolating and quarantining those close contacts that may have happened. From that outbreak data, we can see that about 275 outbreaks have been reported in the office setting alone. That's 6 out of all of the work outbreak settings reported, and that's over the last 6 months. Now, I know that some workplaces are lower down on this list. That's because they're doing well. But restaurant and bars, they had the pause in there, so make sure you keep that in mind. That doesn't mean they're doing poorly. It just means their numbers include the length of time that they were on pause under the DHHS order. But offices have continually been a trend where we've seen continual outbreaks. It's not huge numbers, it's not always low numbers, but they've been pretty consistent. So if we look at the 6 months prior to the months prior to the pause from September, offices reported about 110 outbreaks. Since the pause, it's been about 165. So it's been a consistent spot that we really want to make sure that we pay attention to when we're talking about the mitigation strategies, protocols, and otherwise, and why it's so critical that those vaccination rates continue to increase to make our workplaces less likely to spread COVID. We've been doing a lot of work in the Department of Labor to help businesses open and operate safely. We've been doing this through MIOSHA and our other agencies within LEO. Certainly within MIOSHA and the workplace safety space, we've been doing a lot of collaboration and outreach across the state of Michigan and consultation. And I'll touch on one of our great consultation tools in just a couple of minutes. And we've been helping employers train employees on the health and safety practices, including reporting, health screening, cleaning, and those other things that they need to take into the workplace. And then supporting employers that are working to keep their customers and employees safe during reopening through various programs and opportunities. We've been doing outreach as much as we can to make sure that employers and employees understand the protocols and why they're necessary, for sure. So we have a lot of discussion ongoing about the MIOSHA emergency rules. Those were established on October 14th under the Administrative Procedures Act. Those were put in place for a 6-month period that will be expiring on April 14th. We do expect an extension. The rules as they exist can accommodate a phased-in return that the work group's going to be looking at. We do want to reiterate that while the media has suggested the word ban several times, there is not actually a ban within those rules, but it is important that employers make a determination and prohibit in-person work for those that their work can be feasibly completed remotely. And feasible takes into account things like economics and technology and how those interact and whether or not it's feasible. As you can see from the outbreak numbers, people have been working in offices, but it's an important mitigation strategy that employers must consider when they're putting their plans together to help create that social distance, cut down on the amount of congregation in the workplace, and ensure that they can provide the safe work environment needed in the face of COVID for those employees that do have to report to the office. So next steps, the governor announced a couple of weeks ago that she's putting together a work group, which she tasked our department with doing. We have put together that work group. It consists of business, labor, public health leaders, and others to provide advice and recommendations to the governor on a phased-in return to in-office work. We're going to work through that group to provide feedback. We're going to have ongoing recommendations. We're not necessarily going to wait until we get to the end to provide any recommendations. We're going to do that as they come out of the work group. We expect to complete that work in the next 4 to 6 weeks. It's a very tight timeline. Those that will be participating have committed to this task. It's going to be quite a lift, but we'll make it happen. We're going to be taking input along the way as well. So we'll have some stakeholder engagement opportunities and doing other work to make sure that we get as many voices as possible. We have large business and small business represented, and we're focusing in on some focus areas that we really want to hammer home, and that's the physical workplace and workspace and what challenges might exist there, HR policies, the public health piece of this, how does that impact public health, and how what kind of information we need there to make good decisions, and then employee supports. I think it's important to recognize that employees have been struggling through this crisis as well, and we want to make sure that we understand and hear about childcare issues, school issues, transportation issues, paid leave or flexible leave issues, and make sure that's part of the discussion as we start to move forward in COVID. So this is a recent survey finding from the Business Leaders for Michigan from their members. It's a huge membership base, and they are looking at this as well on when employees that are currently working remotely may come back to the workplace. As you can see, about 50% of employers surveyed are thinking maybe the third quarter of 2021. I think there'll be some movement on that depending on how quick vaccine rollout occurs, how many employees are getting vaccinated. So we could see some shift there. But we're glad to see that businesses are taking a look at this as well and trying to use the safety and health data to make the best decisions they can right now. And certainly at some point in 2021, we do expect to see that sort of return to in-person work. We're happy to see that most companies surveyed also see, continued strong economy in Michigan, expanding employment, increasing investments in Michigan, because it's another thing we try to do in the Department of Labor is to make sure that we keep Michigan at the forefront in job expansion, creation, and opportunity. But many businesses do expect at least some portion of their employees to remain remote. So we're going to see a shift here in the dynamics of business, and there's a lot of pressures outside of everything we're talking about that are going to push that. But we're seeing movement in this way. There's a lot of work to do to get from here to there, but we will definitely work through the work group and others to make good recommendations and best practices to make sure that we can do that safely. One of the great tools we developed in MIOSHA launched in September, updated in November with the partnership with NSF International was the Ambassador Program. We have currently provided over 2,000 free consultations on the workplace safety rules since we launched this program. There are 2 tiers I won't get too deep into, but one's a pop-in and one's a longer scheduled visit. Businesses have been very open to the concept of these consultations to help them implement the rule and enhance their workplace safety practices, which has the added benefit of protecting customers and showing the communities that these businesses are taking all of these precautions very, very serious, and they're implementing the strategies that can help us contain COVID as we continue to battle this virus. We have more information available on that on another spot. I'm going to mention in just a second. Sorry about that. All of these resources, including that ambassador information, are available at michigan.gov COVID workplace safety. We have industry-specific guidelines. We have the emergency rules. We have FAQs on the emergency rules that we try to update as more information becomes available from the CDC. So some of the changes that everybody's putting into practice now on vaccination and quarantine, all of that information is there. There's a link there to the Ambassador Program where you can see that information in those videos. You can also find the link to request a consultation. Those are primarily focused on gyms, fitness centers, small retail, bars, and restaurants. We have opened it up to childcare centers, licensed childcare centers in Michigan, and we're working to expand that out to certain types of office environments as well. So those are great tools and resources you can use there. And don't forget about the hotline. MIOSHA launched this hotline in May, I believe, of last year. It's a wonderful tool that gets you directly into the MIOSHA experts. The average wait time has been about 30 seconds throughout this crisis, and it's a great resource to really get your questions answered quickly. That's at 855-SAFE-C19. Great tool, great thing for you to use as you have questions as you're opening up. If you're an employer and your questions require further development or consultation, they will get you over to the consultation team. If you're an employee and you may need to file a complaint, they will get you over to the complaint side. So been very happy with that tool. MIOSHA is doing a great job of keeping it quick, keeping it correct, and keeping it updated. So make sure you take advantage of that opportunity if you need it. With that, I'll end the slide presentation, and our communications director, Jason Moon's going to help me today with being the MC and any of the questions that have come in.
Yeah, thanks, Sean. We have a lot of questions today. We're going to try to run through as fast as we can and get to as many as we can. First one is, can an employer change their in-person work policies on an ongoing basis? Absolutely. The MIOSHA emergency rule requires the employer to create the policy and make the determination on what work is feasible and what work may not be feasible to be conducted remotely. And that's going to take, as I mentioned, into consideration things like the economics and the technical aspects of those work functions. I think that many employers early on really pushed hard to get people to be working remotely. So there's a difference between, kind of getting there and being able to sustain it, and that might change your determination. So certainly employers can continue to update those policies. Next one, will vaccine distribution among employers and their communities be part of the return to office recommendations? I think it's an important discussion to be had. So
any kind of requiring or something like that is outside the scope of the MIOSHA and the workplace safety work, but those are considerations for employers to be making out there. I think that we have to have it as part of the discussion on whether or not, not as maybe a metric, but just that's going to be a piece to getting back to these types of work environments. Because when we think about offices in particular, they're congregation points. They can be controlled pretty well, but if you have a lot of people in there, it creates challenges, and you have to get people in and out of these buildings. We know in certain cities, that could be an elevator bank that's going to take you up 15 floors or more that you're going to have to consider, because that becomes a congregation point. So it creates a lot of challenges, and certainly vaccination has already changed the quarantine guidelines. It's already changed your personal behaviors from the CDC, and we would expect over time, as they continue to develop those policies and practices, that it will impact what employers may be able to do in the workplace.
Can MIOSHA's emergency rules be modified before or after the April 14th deadline?
Absolutely. So when we think about emergency rules, I know there's been a lot of discussion that you're extending for 6 months. Well, they can be changed. The Administrative Procedures Act doesn't say that you have to remain absolutely static. If we see changes, significant changes that require updating or changes, we do or would have the opportunity to make those types of changes.
Sean, we're getting a lot of questions about the vaccine, and there's obviously helpful information at the michigan.gov/coronavirus site about vaccine distribution and where to find it. But regarding employers and vaccine requirements, can employers require vaccination?
So you'd want to look to the EEOC. They have guidance posted on this specific question. As I mentioned, that one is outside of the scope of MIOSHA. MIOSHA does not have a rule prohibiting employers from requiring it, but they don't have a rule going the other way. So this is really a legal question for businesses and their legal advisors looking at things like the EEOC and the Americans with Disabilities Act on some of those requirements.
This is just more of a general question if you want to hit on some highlights, but what protocols should be in place in an office setting when we return to work?
Well, certainly the mitigation strategies we have in the emergency rules are cover all businesses. There are some specific requirements for certain establishments listed, but all of those requirements above that apply across all businesses, including those with those specifics. So you have to have the masking. If you can't maintain social distancing, you're wearing facial coverings and those types of things. Employers should be considering physical barriers to help protect employees to the extent that they can. You need to limit or eliminate congregation points. So that would be your common kitchen and those types of things. Because as we all know, when we get together, especially within that 6 feet of social distance, without masks, ooh, don't do that, but it creates some challenges. Face coverings, cloth face coverings, even the non-medical grade surgical masks are about 70% effective, we're told from the scientists, at stopping the transmission if we're both wearing them. But that's not 100, so we have to make sure that we're implementing the social distancing protocols, practicing good hygiene, and wearing those face coverings when it's hard to maintain that 6 feet of social distance. I would note too that federal OSHA has updated their guidance, not a requirement at this point, but their guidance for the workplace to consider ventilation as well, because as we've talked on a lot of our webinars about HVAC and indoor and filtration and those types of things, depending on the number of employees, it can create some challenges that you'll want to consider.
You touched on this in the presentation, but I'm still getting a lot of questions, and I think there's still a misconception about what the rule does and what it does and does not prohibit. So the question is in-person work still prohibited for offices?
So as I mentioned from the outbreak numbers, there is no, employees can be in the office. What an employer is required to do is to create that policy by making a determination if an employee's work can feasibly be completed remotely. If it cannot, those employees can be required to come into the office, in which case the employer has adopted and implemented the training, health screenings, face coverings, social distancing, congregation, avoiding those congregation spots and those types of things. So if an employer determines that your work can feasibly be conducted remotely, you should be working remotely, but that's going to be an employer determination. And as already asked, that could change over time depending on the nature of the business, and it's going to be the employer that's making that determination.
Getting a lot of questions about the April 14th deadline and the rules. Would you just care to kind of expand on whether it's likely that they will be extended and what that may look like going forward?
So I want to make sure that we recognize that this discussion we're having today and the discussion over the last few weeks is focused in on one particular rule. So, and it's this remote work policy and what it means and those types of things. So our expectation is we will be extending these rules because we still have COVID and we have to mitigate the spread of COVID in the workplace to protect employees and create those safe work environments. So there are a whole lot of other pieces in those rules that I've already mentioned, like the masking and distancing and otherwise. But absolutely, we do expect to extend the emergency rules. We will have discussions within the work group, the extent to which recommendations need to go to the governor regarding these particular rules, or if phased-in work can be accommodated within those rules. I believe that it can be accommodated, but those are discussions to be had.
Kind of a general question, if you want to expand on what you think this work group is going to get at, but what criteria will the state use to create recommendations that will ensure a phased-in return to work and make sure that it's safe for employees?
So within the work group itself, certainly the governor, DHHS, and others have metrics and data that they're looking at, and certainly they're going to continue to do that. Our work group will want to focus in on things like community spread, vaccination rates, employee supports, as I mentioned, some of those other challenges, creating that best practice guidance around physical workplaces and those types of things. And get that back to the governor so that they can take it into consideration.
We were getting a lot of questions about the presentation itself, and we will be recording this and we will be sharing it through the same channels that we made those invites. So look for that yet today or soon enough. Here's a question about masks. Do employees need to wear a mask in a shared space? And what about cubicles? Can people not wear masks in an office setting?
So absolutely, within a shared space, anywhere that we could have that congregation, intentional or not. So if we're in a shared space, which is going to include in-person meetings, kind of that break room I mentioned where the coffee pot normally is, when you're headed down common hallways and those types of things. Cubicles get a little bit interesting because we know there are different types of cubicles. So if we're thinking of tall wall cubicles, the employee is the only one in there. It provides that physical barrier. Perhaps they don't need that face covering. If we're talking about short wall, then it gets more challenging. And that might be a spot where you'd want to call that hotline number at 855-SAFE-C19 if you have specifics to your workplace that you want to discuss.
We're getting a lot of questions about outbreaks. This may be better suited for our friends at MDHHS, but Sean, do you know what the definition of an outbreak is, or can you provide any more context as to how HHS defines that?
I do, yeah. So it's listed on that coronavirus site as well. They have the definition listed there, which is where we pulled the information from, same information that everybody can have and use. And an outbreak is defined as 2 or more cases linked by place and time, demonstrating probable transmission. I'm a little off on that last part, but it's 2 or more cases linked by place and time. So when we report these outbreaks, that is 2 people, or it could be a bunch of people. We don't have that level of detail in these numbers, but it could be more cases. It's not telling us cases, it's just telling us that that is likely a location where transmission occurred.
I'm getting a lot of questions about the makeup of the work group. I know that we were able to add a few members. There's some questions about representations for small businesses. So I know that we added several members from the small business community. We will send out an updated list similar to what we did with the press release when we send out this presentation. But do you want to just talk about like the makeup and your general feeling about the makeup of the group, how it's filled with labor, small businesses, public health, and other business experts?
Absolutely. I think, we were really focused in on trying to make sure that we couldn't have everybody. So I know everybody watching has ideas, they have input, and we value it. But to move forward with recommendations, we certainly had to hone in on trying to get a cross section of industry, of employees, of public health and otherwise. So we have a good number of large businesses. We've added small business that Jason mentioned will be added to the release, and all the things that we'll be having moving forward. We have a good representation of labor unions that represent workers in these types of environments specifically. That includes the communication workers, AFSCME, and a couple of other unions. We've added in some local public health, as well as we have several state of Michigan departments that are going to be supporting the work group, including DHHS, our own Office of State Employer, our own DTMB, which does facilities work, to add in their expertise. We have a city representative, and I believe we have a county representative too, to talk about some of the challenges they're facing there. And we have a K-12 representative as well. So we're really trying to have a good cross section to look at these big buckets that I mentioned and hone in on some pieces that we can share as a recommendation. And as I mentioned, we'll try to have a broader stakeholder engagement point as we go through the process, because we know there's a lot of interest in this topic, and we want to be as inclusive as we can while still being able to get our work done.
Sean, which rules and guidelines from both the CDC and MIOSHA are followed first? In other words, whose rules should be followed first? Let me also ask MDHHS to that rule set as well. I know that can be confusing to our employers and our workers. You care to expand on that?
Yeah, I do. So what we see is that first and foremost, MIOSHA has authority over workplaces where there's an employee or an employer. There are a few exceptions, but it's very, very small in Michigan. So for just in general terms, you can assume that MIOSHA has authority over workplace safety and health. DHHS focuses in on public safety and health and safety. So their orders are going to be more in line with how you protect those non-employee type folks, and they can have an impact certainly in the workplace, but largely those are designed around community spread, community safety. MIOSHA is focused in on employee-employer, so MIOSHA rules aren't going to extend to your customer necessarily. And then CDC is putting out guidelines, and they're updating the science. And in our MIOSHA emergency rules, we have a few references back to CDC guidelines because they're updating certain information that we're learning as we go. That might be things like I mentioned on the quarantine. So you've been vaccinated. As long as you're 2 weeks past your final vaccination, whether that's the 1-shot or the 2-shot, you do not need to quarantine if you had a close contact for 3 months from the date of whenever your vaccination was complete. So those are the types of things we're updating on the FAQ. So for the workplace, you're going to want to have those MIOSHA emergency rules and put your policies and practices into place. Take the DHHS order and layer in those variables, because they're updating more quickly based on community spread and otherwise that might impact your particular industry. And then we will do our best to keep you posted when CDC updates as it relates to the workplace, the things that impact the rules.
Sean, we're at about time, so if you want to close it up with some statements, I will share with the group that we're likely to do more of these Q&A sessions related to the return to work issue and even return to office, as well as any work that the work group might do. But go ahead, and why don't you close it out for us?
Absolutely. I really appreciate everybody jumping on, taking the time today. Great questions. We know there's a lot of interest in all of this. I think we're all very excited that case numbers had gone down, vaccinations are going up. So we will reach a point where trends are going to change, hopefully. But we have work to do before we get there. I know I've been saying for a few months, there's a light at the end of the tunnel. That light's getting bigger, but we're still in the tunnel. It's going to take some time. Even as supply becomes available, it takes time to get those in arms, to get them effective, and to make sure that we're reaching those immunity levels that we need to stop the chain of transmission. So it's not time to give up just yet. We have to be a little bit more diligent for a while. Variants can spread easier, so we have to be cautious and safe and make sure that we continue to keep it moving forward. But today, again, just happy you joined us. We are listening. We're here. We're doing all the things we can think of to make sure that we're being accessible and available to provide information that you need to keep us fighting COVID in our communities and keeping these numbers in check. So I appreciate all that you're doing. and I look forward to continuing these discussions as we move forward.